Hi, everybody. Thank you so much for having me on your platform. My name is Tito Ovia, and I am one of the co founders of Helium Health. But my real job is I'm the head of public sector growth. Helium Health is a healthcare technology company that's based in Lagos, Nigeria. And our mission is to accelerate Africa's transition into a better healthcare system using data and technology. So in the time since 2016, we developed our flagship product called our electronic medical records platform, which is live in over 300 facilities right now. And is used across 5 different countries in Africa: Kenya, Liberia, Ghana, Senegal, and Nigeria. And we've developed several other healthcare technology platforms that serve providers, payers, and patients. However, focusing on our EMR, the real reason we started it was the problems that we were able to see. We knew that we could not develop an EMR that was so complex and so complicated, like the Epics and the Cernas that you see in the US. We needed to develop something that was sustainable and adaptable to our market. About 53% of our population don't have access to the healthcare system, where there's widespread poverty here in Nigeria. So thus, looking at these numbers and knowing that majority of our population don't have access to healthcare, what can we do about that? How do we make sure that they're able to access our healthcare systems and ensure that they have the rights to be able to do that? And being able to actually ensure that these facilities are able to get the funding that they need, and they're not so reliant on paper-based systems, and people aren't dying because they can't access the quality of healthcare that they need. Again, wanting to be able to digitize healthcare sectors here in Nigeria, was definitely a big feat. Again, how do we create a solution for a population where they have such low computer literacy rates, but again, it's going to take over the operations of facilities and at the same time provide you the information you needed? So we set out to be able to ensure that design was at the backbone of everything that we did with our solutions. So again, creating our EMR that had a social media feel. Because our theory was that, look, if people never used a computer a day in their life, we can ensure that they definitely had WhatsApp or they had a Facebook account. So ensuring that those solutions were mimicked after, those different social media platforms. And that's exactly what we did to try and find out what we can do to be able to solve this problem that we had. So once we were able to do that and we're able to get enough traction, we then ventured out to be able to find our sort of flagship case study state, which we find in Akwa Ibom State. So Akwa Ibom State, for those that they don't know, is a small state in the south of Nigeria that has a population of about 3 to 4 million people, but is very rich in resources, especially in oil. And again, launching our partnership with this state, a first of its kind that we were especially very nervous about. So some of the challenges we faced when we started was firstly the literacy challenge. We already knew going into this situation that we would encounter healthcare professionals that didn't have the necessary skills that they needed using devices to be able to use our platform. But what we didn't expect is that they didn't know at all how to even turn on the device in the first place, how to even type. So we had to actually remodel our training program to start at the very beginning, in which we actually empowered these healthcare professionals with basic computer skills before we then even began to even train them on our healthcare platform. Yes, this definitely delayed the project. However, though, these healthcare workers could actually then potentially leave the public sector facilities and move into the private sector, and they had gained a skill. Again, the power challenge. Those that may or may not know Nigeria know that power is a major issue that we have. To be able to run things, because of the lack of constant power, people tend to have generators, which are very expensive and run on diesel. So our thing was, okay, let's have an alternative power source such as solar. One thing we didn't expect was how much rain there was in Akwa Ibom State and how much it would actually affect these solar panels, because we wanted to ensure that we had 24/7 power to be able to run our solution. So again, having to change different solar vendors, having to test and try different types of batteries to ensure that we could get the true effect that we wanted. And again, the uniqueness of the actual solution itself. One thing we realized was that hospitals are like human beings, right? In the sense that, yes, fundamentally, we all have a heart, we have lungs, we have, a stomach, a spleen, all these things, right? However, how we work internally may actually be different, and the operational differences may be there in terms of our personalities. And that's how hospitals work. So having to sit down and configure each and every single hospital to what they were like and their own uniqueness was something as well we didn't expect, but we were able to do very rapidly by engaging the healthcare professionals and working very, very closely with them. So again, taking on a project like this in which we're doing a full stack solution end to end, with the facilities, ensuring that all the infrastructure that was needed to run our solution was a whole challenge on its own because we had to step out of our comfort zone of just being complete solution providers, but knowing that governments like this is what they required. Again, our solution having to solve for the complexities that there were in the government, solve for the uniqueness, and ensuring that our EMR is customizable and is able to be flexible no matter the situation, ensuring that we're able to solve for the different types of power needs that a facility may need, and doing those assessments that are necessary, and actually budgeting for this and a project like this as well was so important. And as you can see here on our screen, we have an image of one of our flagship facilities called Itungbang in Akwa Ibom State. And you can see its solar panels here on the hospital as well. And I think that one thing to also say about Akwa Ibom State, why it was also the perfect scenario, is that the government themselves were renovating these facilities. So making them prime, locations to be able to deploy electronic software in them. So what was our outcome from doing all of this hard work? We had a 38% increase in revenue in the facilities, which is amazing, right? Reducing wait times for people in the hospitals by 49%, being able to take over the paper-based systems by 95% with our electronic platforms. These are all the things that we talked about wanting to be able to do in the facilities. This is what we were able to pitch in the beginning and what we believe we were able to achieve. Having real-time accessible information for financials and especially data for the hospitals themselves and the government for data and planning. Having them to be able to use this data to be able to venture out and be able to apply for grants and other different programs that they may have with developing partners. Closing financial loopholes, so ensuring that these facilities are profitable and ensuring that patient data is stored in the best way possible and ensuring that the privacy of it. And most importantly, ensuring that staff have accountability. So thank you so much.
I wondered if you could describe a little bit for us the kind of tools or methods that you used, firstly, to establish the needs of the people in Akwa Ibom State.
So before we even started, so first of all, as a technology company, one of the things that we've seen from maybe other developing partners or other people that try to be able to implement technology in government is that they didn't do a needs assessment. They sort of came in with their technology and said, this is the solver of all your problems. And that honestly is not the way to go about things. So before we actually even started the project, we spent actually a couple months assessing on ground, the level of staff they had, the skill level they had, even the states of the facilities as well, to be able to give the government a picture of where their healthcare system is now. So we could actually clearly state that this is what our solution is going to be able to do. And this is how it's going to be able to, I guess, improve your healthcare systems. So really that you can hold us accountable as a company, right? And we could say, look, you know what, we've been able to grow your revenue from, by 20%, 30%, and this is what it was beforehand. Or we've been able to improve the skill level of your staff from having no basic computer skills to them all being proficient in typing, right? And using Excel and things like that. So that way as well, when you have your stakeholders being able to see those kind of assessments that they do, they also then value the work that you're doing as well. Because sometimes, with work that we do, especially in health technology, it doesn't happen overnight. The changes don't, but it happens gradually. And being able to mark and hold us accountable helps, state governments be able to see the true value that they're getting. Yeah.
Could you describe perhaps some of the co-design activities that you use with participants, and maybe something that worked well in contextualizing that EMR platform?
Yes, so definitely when we were thinking about our EMR and how we wanted to build it in the first place, I talk a lot about, our computer literacy skills here in Nigeria. So, we have fantastic doctors, fantastic nurses, fantastic healthcare workers that are brilliant. However, though, whether in their schooling or whether, in their trainings, they haven't had the opportunity to be able to, necessarily use a device every single day as part of their life, right? So one thing that we really focused on is that knowing that even though they may not be that proficient in typing, or they may not use devices or anything like that for complex work, or all these different kind of tools that people use all around the world. However, they most likely have a Facebook account, or they have a WhatsApp, or they use something like that to be able to communicate with family and friends. So our goal was to, how do we now replicate this in the design of our EMR, right? To ensure that it is sustainable and adaptable, to ensure that it's something that looks familiar and it's something that they would want to continue using. So it's not about trying to, quote unquote, dumb down a product or make it, yes, usable for the market. No, that's not what I'm saying at all. It's about, how do you make it more adaptable to the market, and how do you make it more user friendly, in short? Because I think that when everybody thinks about complex technologies like this, they also assume that it can't be user friendly, or it won't be user friendly at all. But we've sort of added a lot of color, a lot of great features like that to ensure that that was our key priority. So whenever we're actually expanding the product or adding a new feature, it is hand in hand, comes in with design and what is the best way. And we test out features. We ask our various clients to ensure that, it is represented in the best way for them. Yeah.
There's one here from Abubakar Yarima. Could you please comment on your experience getting the healthcare workers to adopt or adapt the EMR system? Was there initial resistance or pushback to that adoption?
So most definitely there was. I mean, I don't think we would be doing our work well if there wasn't resistance or pushback to the solution. And the truth of the matter is that wherever you go in the world, it's not just, Nigeria, the US, the UK, there is always resistance to the adoption of technology in healthcare facilities. And this is because the solution is not just coming to work in one part of the hospital or the healthcare facility. It's almost taking over, and in a good way, actually enhancing the operations of the facility. And a change like that can be scary for anybody or any stakeholder, because truly it could mean life or death, right, for a patient. If it works well, it means that, improved quality of care. It means that shorter wait times and all these added benefits. But if it doesn't work well, it could be the difference between, a misdiagnosis or somebody prescribing something wrong or anything like that, any little issue like that, that could be between life or death. So most definitely we came in prepared already knowing that there would be resistance. But our real goal, and especially in the beginning, was to win over the healthcare workers, to be able to show them that the added benefits, to be able to let them know that there was constantly support there for them. So even though we launched till 2018, part of our model, our business model, is that we actually have at least one member of staff posted to the facility at all times. And this is to ensure that, they can help or just handhold any new staff members that may come in, and ensure that, they basically can walk them through any issues or help them updates or triage or things like that. So they know that we're sort of doing this together as a team,